moment. Yeah. Well, let's talk about some of the science that you're really into today. So just start out with a broad view and keep it brief. You could probably talk for an hour about this, and I know you do on your lecturing tour. But can you just briefly summarize for us kind of the science behind stem cells and where that started and where it is now?
Yeah, so stem cells really started when we didn't know it was stem cells. So that started with the bone marrow transplant in the 60s. So that's when we can transplant the stem cells that are in the bone marrow from one person to another and promote incredible healing, right? Healing pretty severe blood cancer conditions or even autoimmune conditions. And then we found out, there are stem cells, and we thought only bone marrow has stem cells. And then as science progressed, they realized that we have stem cells all over our body. Anywhere you have, actually, there's one type of stem cells that's heavily investigated and used these days. It's called mesenchymal stem cells. And that's everywhere in your body. Anywhere you have blood vessels, you have these stem cells because their position in your body is along blood vessels. So they will hug your blood vessels and they will sense what's going through your blood. And they will also sense what's going on in the environment where they're sitting at. And then they start to coordinate. If something systemic is going on, then they can send certain signals. They can help the body that way. Or they can travel, squeeze themselves into the blood vessels and find their way into where the signal was at, and then get out and start to tell the blood to send immune cells and certain, basically giving your body signals to promote local regeneration. It can send all kinds of signals to the local cells, including telling the local stem cells to divide and differentiate and to start replenish the tissue. So they're considered the orchestrator of regeneration. And there are a lot of different kinds of stem cells, starting from the first fertilized egg all the way to the end tissue-specific stem cells. So when people talk about stem cells, it's really not a singular form. It's a lot more complex. The stem cells have 1,000 different variations from the starting point. So where do you use it? At what point do you use it? And for what kind of tissues? There's so much nuance. But these days we can tap into a lot of the signaling benefits from the mesenchymal stem cells. So that's where majority of the research is at. And the research has been very active from all around the world. And that's what I teach in the academy, where I train physicians, because I give them data. I give them research results for different conditions. And that has been proven very widely, starting from the most common musculoskeletal. I mean, that's the most commonly used repair, right? Tendon, bone, any kind of soft tissue repair, joint regeneration, and then neurological disorders, from traumatic brain injury to Alzheimer's to Parkinson's, ALS, MS, etc., and autoimmune conditions. There are 122 different autoimmune conditions. I think it's silly to really name them, all these different names. Is really very few things going on that's just manifesting in different organs. And then there are all these internal organs, a lot of evidence for heart repair, cardiovascular system, for lung regeneration, liver, kidneys, or even fertility. They're wide ranging. So in our clinic, we see patients with all kinds of chronic conditions. And it's, people are desperate because the traditional medical route, they can give you medication after medication, but are they really fundamentally making you better? Or are they just having you hang on so you can keep taking the medications?
Yeah.
So
that's a great point. I want to double click on something you just said, going back to the kind of the tissue specificity. I talk about stem cell therapy a lot with my patients because many of them are interested in it. And so I've done my kind of baseline research, but again, I'm learning a lot listening to your stuff online. So the mesenchymal stem cells, mesenchymal, yeah. So that's what we use. I think there's, and maybe you can dispel this myth for us. There's not, when you're getting stem cells, you're not getting a tissue specific stem cell, right?
No.